Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. I'd like to welcome Dr. Rafé Zaidi and Dr. MinhTri Nguyen. Thanks for joining us today, Rafé and MinhTri.
Kim, thanks for having
Thanks.
us.
Yeah, thanks for having us, Kim.
You're very welcome. By way of brief introduction, Dr. Rafé Zaidi is a transformative healthcare physician leader championing patient-centric care and safety and driving cultural change through engagement and innovative stewardship. And Dr. MinhTri Nguyen is a hematology oncology physician, certified professional coach, researcher, always learning. And I just saw my own hematology oncologist yesterday, and he's awesome. So I appreciate everything that both of you do. So thank you so much. And I'm really looking forward to our conversation. And today we'll be talking about emotional intelligence and how it relates to leadership and burnout. And I always start by asking you what you'd most like our audience to know about you as we begin our conversation. And you can feel free to include hobbies, your background, what drove you to medicine, anything. So, Rafé, would you like to go first?
Sure. I'm used to being voluntold. Uh, yeah, no. So again, thank you for having me here today. I'm a family medicine doctor by training, practicing just over 12 years now. And a little bit about me is that, in a professional sense, I consider myself a servant leader. In a personal sense, I'm very data driven and very I guess we call them our colors green, where the other side of me is a little bit more open, extroverted. I love to socialize. In fact, me and my wife are going out to a gala tonight. And in my spare time, I love enjoying reading and audibles in addition to woodworking. I have a little shop in my garage. I spend some time there as well. I have four beautiful children and a beautiful wife. My oldest just started high school, so that's giving me some palpitations these days. But again, happy to be here and getting to know all of you more today.
Okay, well, thanks. And how about yourself, MinhTri?
I'm a hematologist and an oncologist. I finished my fellowship just recently at the Cleveland Clinic, and now I'm here in California, starting my practice. But I'm one of 16 children. I immigrated here when I was really young, 10 surviving now, siblings. But a lot of that sort of experience as a child really drove my wanting to go into medicine. We just had, a lot of different experiences growing up, and I think that kind of just drove me to try to fix what I saw as problems within the healthcare system. What drove me to leadership and emotional intelligence is throughout my career, my educational and academic experiences, I've sort of been I don't know, just sort of like inadvertently fallen into these sort of leadership positions or situations, and I kind of found them really interesting academically. So I started studying them and then having a lot of really great mentors who kind of work in that space. So then I started deciding, maybe I should start doing a little bit more, and that's kind of where the marriage between medicine and all of this other work comes in.
Hmm. Well, thank you very much. And Rafé, if you would like to share a bit what drove you to medicine, and you too are a physician leader, and how your relationship with emotional intelligence and leadership.
Mhm. Yeah, I would share a lot with what Mintry just stated. It does come back to our roots and our family. And my dad had his first cardiovascular event, heart attack at age 40, and he died at 65. And growing up and going through doctor's visits and just looking at just the complexities of everything that he had to go through at a young age, and eventually had kidney transplant and dialysis kidney transplant and all the complications that came with it. I decided to be more engaged in looking at finding solutions into those complexities that we as patients and as physicians encounter on the day to day. And again, I found myself landing myself in roles that either I was self-volunteering me for, or I was being voluntold for, and it's just kind of a progression of events that lead me to share my experiences with you all today, and maybe more to come.
Hmm. Yeah, well,
Mentorship has been essential, and I so agree, MinhTri. It's the tribe that you build around you and the people you have around you that really get you to be where you are.
well, and thank you. I can relate on a personal level. My own dad also had a kidney transplant and was on dialysis. He died about 7 years ago, but I
Mm,
understand all the intricacies that go with that.
yeah.
And MinhTri, we had you select the topic today. So if you wanted to speak a little more how you chose that you'd like us to talk about emotional intelligence and how it relates to leadership and burnout.
This is an academic interest of mine, but I guess I'll start off first with just that there's such a need for physician leadership. I think um, we all see physicians as clinical leaders, but usually what happens is when a physician is trained for their entire lives, it's mostly in the clinical sense, right? So you go into med school and you learn about medicine and you learn about all of these fields within medicine, but leadership is like an adjacent field that has its own research, has its own, criterias for how to do things. And I think physicians sort of miss out on that piece. And then when we get to a point where, we're mid-promoted because we're doing really well. But we get promoted because I think of our clinical acumen most of the times, and we sort of lack that background training. Sometimes we lack that background training. And so we get promoted and we sort of find ourselves in these situations where, we've never done things like this before. Leading non-clinical and clinical teams together and kind of incorporating all the knowledge that comes with both fields that we half of it was missing from the beginning, right? So I always find it really interesting because what we do in healthcare is that we take sometimes our best physicians because they're so good clinically and we promote them. But then what we just did was that we took our best physicians and then we might have just gained a horrible leader in its place, in their place. So I think there's a huge need for physician leadership, and I think physician leadership is actually very important, right? There's a lot of studies that have been done that showed physician-led hospitals do so well, not only in quality, patient satisfaction, but also even economically. Like there's no downfall here economically for physician-led hospitals and physician-led organizations. And yet, I think physicians find ourselves struggling often when we get to these roles, and the percentage of physician-led hospitals has drastically decreased since like the 1930s. It's like down 90%. So I'd like for physicians to feel like they're in more control and more power when it comes to leadership. And so that's why I started looking into what's a really good way of incorporating leadership training early enough in medical training that has the like sensitivity that's required for medicine, that is still very a core sort of value for leadership and medicine. And so that's when emotional intelligent leadership came in, right? So I started learning about this. This has been my work for the last 3 years. And I currently have an ongoing research project with the Cleveland Clinic trying to figure out some of these pieces for early medical trainees.
Hmm. Go ahead, Rafé.
Oh no, that's I love everything that you're doing here. I emotional intelligence, I often have viewed in three kind of buckets. One maybe around awareness. And empathy is a common one that we all hear about. But then motivation as well, like what drives us, right? So, when I try to mentor my colleagues or my co-physicians, the first thing I try to gauge about them is how are they driven? Are they intrinsically or extrinsically driven? And then the awareness piece as well kind of comes down to that self-awareness and that introspection, in addition to that social awareness. And really, I think that social intelligence, a part of emotional intelligence, is just so critical. And it's a work in progress, but I often feel like I connect it to resilience and fortitude. We in physician training have this unique resilience to push through, and then you're just let loose and free, and now you're expected to navigate it on your own. And you might do well on your own, but then how do you do it as a tribe, or how do you do it in a scalable manner? And I think that's kind of where that leadership layer gets added on for physicians, as another skill set to just refine and hone. We at birth are designed to be in service of something, and going back to kind of that servant leadership growth mindset is, even as when we're born, we're actually serving a maternal instinct, right? And by proxy, we're even training our own mothers to have the development of that maternal instinct. And then you're trying to serve your parents, then you're serving your peers, then you're serving your society, and then you're serving your spouse, and then your family. You're driven by something in service, right? So and those are all opportunities that we just become witness to what's around us. And that is, I think, the method how which we hone our resilience, and then the end land in some place of what we like to call fortitude. And it's only when we step away from it, and you mentioned burnout, right? So when you start stepping away from what might have been an organic path for me, and now I'm no longer in that service, except only to myself, and I ignore my environment, that becomes a dark, lonely, place. And that's, I think, where burnout, in my experience, kind of begins to initiate from. And so having that tribe and that mentorship around you and that social awareness, it's kind of my approach in my experience.
Hmm.
I completely agree with you. And I think that social piece is so important, that social competence piece. And, I know there's like a lot of like different models out there of like emotional intelligence and what it all means, and how do you define it?
Yeah.
I use sort of like the Dan Goleman, and based off like the Solovey-Mayer sort of model, right? There's that like four quadrant, and there's that whole piece of social competence, which is, of course, managing, like understanding what your social surrounding looks like, but then also sort of the relationship management, right? Taking that a little bit further, and what you talk about, like how do you manage a whole group of people, like a team of people now, and their emotions, right? Because believe it or not, the self and the people around you, we are all humans, and our behaviors are as logical as we think they are. They are 100% driven by our emotions, if not, like 90% of the time driven by our emotions, right? So I think it behooves us as physicians who deal with people from all walks of life, and people who are clinical and non-clinical, to not only be self-aware, understand what emotions drive our behaviors, but then also understand what the person sitting in front of us, what their emotions are like, and why their behaviors are the way they are, perhaps because of what they're feeling. This could be someone who is, your patient, obviously, or this could be someone who is, someone who's working with you, a colleague, your nurses, your MAs, your medical student. So I think it's so important, and I agree with you. That social piece, extremely important, and I think you need somebody there to kind of help you walk through some of that sometimes.
I had a mentor once who gave me some great advice, and in my leadership journey and my even my professional journey and taking care of patients, I felt like I just had to do so much for them and solve for the social gaps and all of this. And I said to him that, I just want to be impactful. I want to generate impact. And he actually humbled me and came and asked me, impact on behalf of whom?
Hmm.
Right. And it really got me to think in that self-awareness space again of like, okay. And I was dealing with some simple things in an office where a manager was dealing with something and the physicians were dealing with something, the FOAs and the MOAs, they were all dealing with something, and everyone was almost in a way against each other, but not. And we all had to kind of come back to say, okay, we are here working as one team, but are we upset because you're not finding some piece of your job equitable to another? But if that equity is being the impact on behalf of whom, did we just forget our patients? Did we just forget generating that impact on behalf of our patients, that equity and that justice and that compassion on behalf of our patients? And it was very awe-inspiring for the whole group to really think about it that way again and really realign our kind of mission-driven culture.
Hmm. I was wondering if, oh, go ahead, MinhTri.
Oh no, Kim, go for it. Yes.
Yeah, go
Okay,
for it.
so when Rafé spoke about serving and you're born with the servant, I love when you were talking about that. And what I've heard is when students are trying to apply to medical school, they're competing each other for the best whatever college, and then the best medical school, and then the best residency, and then the best attending position, and that can drive you towards silos, even if your inherent nature might have been to serve. And I was wondering if that brings up, and then how you turn that around and bring it back since you both speak to servant leadership. So go ahead, MinhTri.
Uh, you know, uh, Rafé and I talked about this at one point about sort of the different types of leaders that you can be. And I think there is a certain type of person who enters medicine. And I would, I'm optimistic in saying this. I would think that the vast majority of people who enter medicine, it's for altruistic reasons. And so I think servant leadership follows that sort of mentality. And you're right, there are sort of detours along the track that sort of people kind of fall off and they look at other types of motivations. And so, one type of leadership can focus on leadership model, right? But then there's also this leadership model that can be about productivity, having outcomes, good outcomes, right? And I'm not saying either is good or wrong. I think that there are just moments for each of those, and there are moments where you can do both. So perhaps, our medical sort of situation, the way that we apply for med school, whatever, sort of puts medical students into these roles where they feel like they have to achieve in order to get to the place where they can finally be altruistic and do these things. Some may continue to just want to achieve, but yeah, it just kind of works on, I think, the intrinsic and extrinsic motivations, I think, that Rafa was talking about.
I do I I find that there's an overlap where there is a common ground, and that word I use and most use is compassion, right? And so compassions can drive a number of different outcomes. And I remember getting introduced to this through a professor, Dr. Tresiak. I believe he's in New Jersey. And there was a TED Talk, I think, that he had or it was his partner, how like 40 seconds of compassion could save a life. And I got into a book called Compassionomics. And that book really talked about how compassionomics is like the prescription and providing compassion, treating patients with compassion, and is a productive outcome that's measurable, reproducible. So those that may be more outcomes driven, productivity driven, you can still drive that outcome, but while being in service. And I believe that critical element of, I guess, tangible, measurable skills versus those soft skills need to be aligned better in the training process so one doesn't lose sight of them while in the delivery system that is healthcare today. And I believe a lot of strides, and I believe even the work that you might be working on with Cleveland Clinic and others may be somehow connected to a lot of this because I know they've done some work in this space.
This is exactly what I'm hoping to do, right? And by no means am I the only person. I just love this work because it is trying to tie those two pieces together, right? We can be productive, we can also be human. And I think my personal experience is that I'm the best, I think, in terms of productivity when I am human. When my patients sit in front of me and they're asking me, I have this cancer diagnosis, what does this all mean? And the big question of, am I going to die comes up. Like that's a pretty rough scenario. And there's nothing that you can look into in terms of data to answer that question for that patient, right? And so I think that's when we become human and we talk to them as another human being, we ask them, well, like, why are you asking that question? Like, what are your motivations behind that? And I think that kind of gets to more of the humanistic piece of why we become doctors. And so to go through all of this medical training where we learn about all the statistics, we learn about all the facts, the data, um, productivity, all this stuff, right? We might lose a little bit of that sense. So if we can get some of that back in our training. And so Dr. James Stoller and Laura Mintz, both physicians in the Cleveland area, they had this systematic review that was published in the Journal of Graduate Medical Education. Wonderful systematic review where they looked at what are the implications for emotional intelligence and leadership, physician leadership. And so they took all these articles. It was like a lot of articles. And they went through all the data to try to kind of gather what would be like the main sort of bullet points of all these studies. And what they discovered was this, that one, emotional intelligence is broadly endorsed as a leadership learning strategy. Two, models for EI, emotional intelligence and leadership development can be applied broadly through any sort of level. And third is that it's widely endorsed as a component for curricula for developing physician leaders, right? So for physicians specifically, because like what I said before, it helps with that sort of like sensitivity that we need in medicine, that humanistic property that what we all kind of instilled when we applied for med school in the first place. So yeah, I'm really hopeful. I hope this pans out, and I hope that we can change medical education because I do want to believe that we all are in it for altruistic reasons and productivity.
Yeah, and MinhTri, doesn't that provide a huge amount of agency that we as professionals have almost felt like has been lost, right? And we use the word autonomy a lot, but when agency is used, it implies choice. And I think what you're talking about really just levels it up and say, wow, I actually have agency in what I do every day.
And this goes back to like the physician-led hospital organizations or physician-led healthcare spaces, right? Oftentimes, those organizations are very geared towards community spaces, understanding what their community needs and how the hospital system or the organization can cater to those needs or provide access to those needs. I think that is what I like to envision as sort of the perfect combination of physician leadership and emotional intelligence, right? Like you're leading this very productive organization, but you're very mindful of your surrounding and also of the people in them and what they need. Um, that would be, I guess, the best outcome, I think.
Totally agree.
If I could interject for a moment, so I think you may know that I'm going to be involved next week at the New York City prior to the Burnout Symposium, the Medicine Forward team. We are doing an open space workshop on restoring and nurturing the human connection in healthcare. And I'm
Yeah.
very excited about that, and we'll see what comes of it. And when you spoke to compassion, I think not just for our patients, but you need to first have compassion for yourself, right? And that's not just words, it's critically important. And then have compassion for all the other players, whether it's your medical assistant, your team leaders, but then they too need to have compassion for you.
Yeah.
100% agree that like when I think when you mentioned self-awareness at the beginning of this, that self-awareness, everything starts with the self.
Mhm.
And not in condition to become selfish, but to become selfless. But it starts with the self, either which way you look at it. I always found that to be very poetic.
And we're talking about burnout as well, and
Yeah,
I can't tell you how much that understanding what drives you really helps to define what may burn you. I think we lose a bit of ourselves when we get lost. We lose that self-awareness, and I think that's why really physicians burn out quite a bit is because we sort of lose that. We lose that motivation or drive to that we started in the first place. So people with high emotional intelligence have less burnout.
So I'm sure you've come across people that you work with who have some difficulty doing this, right? So I'm just wondering if you'd each like to speak to what has helped you overcome, challenges in this area and advice that you would have for your colleagues.
Okay,
Man,
you
I'll
want to
let you
start?
take this one. Yeah.
Oh, okay. Okay, yeah. Um, so part of my work is that I do a little bit of leadership coaching, right? And so I'll talk about, a certain scenario where, yes, I coach sometimes medical trainees who are having a really difficult time. And in one scenario, I think what really helps sort of walk through a lot of this is sort of asking the right questions, having someone else to ask you the right questions. Maybe you yourself can get to it, but if you don't, it's so important to know somebody who knows you or even someone who doesn't know you, but can ask you the right questions. And so, in asking those questions to develop that self-awareness again, remind you of the motivations that brought you to medicine in the first place, and sort of relate those to sort of, does that continue to drive your work today, and how has that changed? I think that that is one way of just sort of looking at the challenge ahead. This one scenario that I want to talk about is, I had a medical trainee who was struggling really hard with not only the knowledge aspect of medicine, but also sort of just the social aspect of it, understanding what is, what patients needed from them, what their mentors needed from them. And I think just kind of coaching through, how do you develop your self-awareness in these situations? So asking when you were asked to do that, did that align with your values? Is there a way to say that this doesn't align with your values in a nice way to provide some understanding between two people who might be in a conflicting viewpoint? But yeah, I do think it's nice to have someone to sort of help walk you through some of these conflicts of, losing self-awareness or even burnout, because by rephrasing or reframing a situation and even providing experience from another perspective, it could be very helpful.
I love that. That's it connects. I love that you use reframe and rephrase. Um, I'm going to give in a nutshell, a simple example of from a faith-based perspective. I often believe that, God only helps those that help themselves. Then God also says that the best way to help yourself is by helping others. And it's just this full circle that goes around. So when I start to find at a time where I was I wouldn't say in a dark place, but in a challenging spot, maybe, between a rock and a hard place, and not knowing which direction to take my career or to which direction to take my relationships, and kind of got in a chasm and financial challenges, the adulting, right? Right. So yeah, and it really allowed me to open up and find the things that I enjoyed to do. Like I'm just a learner and I've always considered myself like an educator. So I started picking up books again. I started like learning about how my emotions actually were working with me. I picked up a lot of books on soft skill development and learning more about my emotions. In fact, I will say, and this is definitely not anything that I'm ashamed of, but like I went through a tough spot in my marriage, and one of my favorite books was The Five Love Languages,
Mm.
and it allowed me to reframe something that I could never put a name to. It was an emotion, it was soft, and a skill that I often tell some of my colleagues to do is, okay, when you're going through the days of this emotional roller coaster, give what you're feeling a name.
Yes.
And once you start giving it a name, actually, I shared this with a patient just 2 weeks ago. I didn't know there was an app, and they were already aware. I'm like, "Oh, do you mean this app?" And he showed it to me. And I can't even remember the name of the app, but that's all it was. It was like an app that just had word bubbles and
Hmm.
2,000 words of like just, yeah, this is me. This is what I'm feeling right now. And I could imagine how therapeutic for an adult, it kind of like a pop-it would be, uh, to push on your phone. But I think, my advice, and back to your question, is, yeah, we need to really understand what will continue to drive you, and that intrinsic drive will push extrinsic drive, and extrinsic drive will ultimately end up falling back onto an intrinsic drive. So you're always in a dual drive mode. I call it all-wheel drive in a way. But that takes time. So, back to what you're saying, you need to step away and find your tribe and find your time.
Yeah. Give yourself a little grace, right? And you are, I think, the embodiment of self-awareness in that situation. I, I think that's such a great example of it because physicians, we often get stuck in our own ways and thinking that we have to know everything. We have to be the one with the answers, even for ourselves. And sometimes we just don't. And yeah, I think when you go back to it and you kind of try to define what sort of is causing the issue, that's a beautiful way of just getting yourself restarted and refreshing so that the burnout doesn't get to you. You put out the fire. Um, Also, love the piece about naming your emotion because that is the first thing I do with people who want to learn about emotional intelligence, right? Is like name the emotion, but also increase your vocabulary in terms of the emotional like naming, right? That is a really good way of increasing your emotional intelligence because is it boredom or is it ennui? Like so it's very, I think it's very specific and so that the other person knows exactly what you're feeling.
So my physician coach shared this feelings wheel with me, Dr. Michael Hirsch, and I tried to reach for it, but I can't find it quickly enough. So you can Google like feelings wheel, and he'll even share how he used to think there were maybe like three things, like or happy, mad, sad, and angry, whatever, angry or something. And but then he saw when she showed him this feelings wheel, he's like, whoa, like there's a lot of feelings. So if you
Mhm.
find that app, Rafe, I'll put it in the show notes
Yes.
and but otherwise, you people can look up the feelings wheel. And also, when you speak to doctors, feel like they have to know everything. Like just to tell yourself, nobody in the universe can know everything, right? To give yourself grace and don't expect for yourself, and no one should expect of you that nobody can know everything. And then the other thing I would say is if you have any tips for asking for help, because either when people are burnt out or if they feel like they should know everything, especially doctors, I think they find it really difficult to ask for help. So if you have any suggestions on how to find a safe person or how to ask for help, if each of you want to speak to that for a moment as we wind down.
Yeah, I
Yeah.
would add, I've encountered a lot of folks that do have trouble asking for that help. And the downstream it's because they have a perception that they don't have time for it. And part of what I think our leadership as physicians should be inclusive of is helping our physicians reduce the cognitive burden that they carry. It's really not the number of tasks. So if we focus on helping them alleviate some of that cognitive weight, they can actually open up to feel like I can carry on the gym today, or I can carry on getting in another 30, 40 minutes of sleep today, or I could carry on, a 30-minute walk today. So I think when I frame it with some of my colleagues and my professionals, that's the example that I use. And when they hear that, I can almost tell you 100% of the time, they're like, yeah, if I could just get rid of this or that, or we call it the fruit flies, right? Like if you could just get rid of those fruit flies, like I can actually start cooking in my kitchen, you know? So I think that would be a way to start. And that's kind of an approach that in my current role, I'm learning to implement a little more.
Hmm.
I think this is also where reframing is really helpful because when I coach people on asking for help because they're so overburdened with all of these tasks and all of these emotional burden, the way I like to reframe it is this that asking for help I think we associate with being weak and um, Brene Brown does really good work in this. She has this, she talks about sort of like the power of vulnerability. And for an oncologist, I find this very useful in my work, which is that when I am vulnerable with the patient, not only do I build a really good connection with them, I earn their trust. And I think it's that trust that really gets them through their treatments, a lot of the side effects, a lot of the really tough decisions and discussions that we may encounter at some point, and I think that the power of that vulnerability exists not only in just the patient who's sitting in front of you with their gown on, exposed, but also with the physician. So I would encourage my physician leaders to think about how they can be vulnerable because it's a power and it's not a weakness. And in doing so, you not only alleviate yourself of sort of the burden of tasks at hand because you ask for help, but you also learn and you also develop a relationship and trust with the people who you ask.
Well, thank you. I love that so much, and I wish we could go on for like another hour. And what I'm going to have you do is each send me links as to how our listeners can get in touch with you. So I just wanted to thank you again for being my guest today. I loved our conversation, and I knew I would.
So much for having me.
You're,
Yes, thank you so much, Kim, and keep doing what you're doing because you're so amazing at it and connecting us. It was so nice to meet you, MinhTri, as well, and
Yeah.
I know we'll stay in touch.
Yes.
And I was excited to do this. And in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.
Thank you.